Hi, and welcome to the ACRO video series designed to introduce some basic concepts in radiation oncology. I'm Michael Scherer, the ACRO Resident Committee Education Chair. The goal of this video is to explain some of the most commonly used types of external beam radiation and the many acronyms that go along with them. To start, we'll break radiation treatments into those that are forward planned versus those that are inverse planned. What does this mean? In forward planning, the arrangement of beams used to deliver dose to a particular target is manually selected. In inverse planning, a computer planning system is given a target and automatically arranges the beams to provide appropriate coverage. Let's look in more detail, starting with forward planning on the left. The most common form of forward planning you'll encounter is called 3D conformal radiation, sometimes abbreviated as 3D CRT. Here you'll see an example of a field to treat the lumbar spine and sacrum. The physician creates the field to encompass their target by manually moving the jaws, which set the overall border of the radiation field, as well as the collimators, which allow for a finer level of control. 3D CRT often uses two beams of radiation, one entering from the front of the patient and one from the back, in what's known as an AP-PA setup. Treatment can also be given with four beams, one coming each from the front, back, left, and right, in what's called a four-field box. Despite the name, 3D conformal is actually typically less conformal than more modern inverse plan techniques that we'll talk about next. The most common example of inverse planning is intensity modulated radiation, often called IMRT. Here you can see that the computer algorithm shapes the beam in a way that no human would. This is possible because there are usually many more beams than 3D conformal radiation, usually at least 5 or 7, or often a continuous arc where the collimators are constantly moving throughout the treatment. This allows the dose to be more tightly shaped around the target. On the top, you can see an example of a plan with fixed field IMRT, where there are still discrete entry points, but the beam is shaped differently within each one. For example, to help avoid the femoral heads when entering from the side. On the bottom is a continuous arc plan, where the radiation enters from 360 degrees all around the patient. This is known as volumetric modulated arc therapy, aka VMAT, or arc therapy. The last concept to introduce is stereotactic radiation. This is traditionally called stereotactic radiosurgery, or SRS, when used in the brain or spine. Elsewhere in the body, it is often called stereotactic body radiotherapy, abbreviated SBRT or SABR. The principles underlying these treatments are very similar in that they use a very high dose per fraction given over 1 to 5 treatments. Because of the high dose, it is important to conform the dose tightly to the target, and inverse planning algorithms are almost always used to deliver SBRT and SRS. This concludes our introduction to different radiation modalities. There are many other treatment techniques that you may encounter, but hopefully this helps provide a good understanding of the most common treatments we deliver.